From the JAMA Network, this is JAMA Ophthalmology Author Interviews. Conversations with authors exploring the latest clinical research, reviews, and opinions featured in JAMA Ophthalmology.
Hello and welcome to our listeners around the world. You're listening to JAMA Ophthalmology Author Interviews, and thank you for joining us. I'm Neil Bressler, Editor-in-Chief of JAMA Ophthalmology. Today, we're going to look at a meta-analysis of the prevalence and healthcare disparities of retinal conditions. Joining me is the first author of that investigation, Dr. Alvin Liu. Dr. Liu is an associate professor in the Department of Ophthalmology at the Johns Hopkins University School of Medicine, where I also am on the faculty. Dr. Liu also serves on the JAMA Ophthalmology Advisory Committee, serving as its liaison of JAMA Ophthalmology with JAMA Plus AI, a super channel of JAMA and the JAMA Network. Alvin, thank you so much for joining us.
Dr. Bressler, it's a pleasure to be here, and thanks for having me.
Maybe we could just start with the objective of your investigation. What did you want to look at? Are there no summaries? Are there no meta-analyses on the prevalence of healthcare disparities and retinal conditions?
Thanks for that question, Neil. I'm happy to provide an overview of the paper and specifically why we wanted to do this paper to begin with. So this paper provides an updated 2022 U.S. prevalence estimates for 4 major VEGF-driven retinal diseases that are the leading causes of vision impairment, and they include age-related macular degeneration, diabetic retinopathy, diabetic macular edema, and retinal vein occlusion. So the goal was not only to estimate the national prevalence, but also to describe the disparities by sex, gender, race, ethnicity, and geographic variation down to the state and county level. Now, as you correctly pointed out, Neil, there have been studies that looked at national prevalence of similar conditions. However, we do think that our study provides several innovative contributions. So first of all, we did combine and integrate different data sources, including NHANES, the Medicare database, and some commercial claims databases.
So you're looking specifically at very common retinal conditions that are all treated with anti-VEGF. Is that what they have in common?
That is correct. There are a few reasons why we decided to bunch these conditions together. Number one, from a pathophysiology perspective, they are mainly driven by VEGF. And second, their treatments are also very similar with some variations. But because they are primarily treated with repeated intravitreal anti-VEGF injections, that will give us a way to estimate the cost and economic burden of these conditions. And number three, all 4 conditions are primarily treated by retinal specialists. This also allows us to look at the relative disparity in patient access to retina specialists. And those are the reasons why we decided to group these conditions together.
So what cohorts did you look at? Did you look at some prior clinical trials? Did you look at insurance claims? What were the actual patients or groups that you looked at to try to define the prevalence in the first place?
To define the prevalence, we looked at 3 major databases. The first one is the NHANES database. The second one is Medicare fee-for-service claims. And third is a market scan commercial claims dataset.
These groups then have identification of who has these various conditions. For example, I know in diabetic retinopathy, not everybody is getting anti-VEGF. How did you determine who actually has the condition and specifically has the condition that needs anti-VEGF?
That's a great question. So from these 3 data sets, we were able to identify the number of patients who carried the diagnosis of these 4 conditions that I mentioned. And we also know about their demographic information, including where they are physically located. However, we were not able to directly ascertain which one of them were receiving or have received anti-VEGF injections. However, we do think that by publishing the national prevalence of these four conditions, our publication will provide a foundation for future studies that will be more specific in terms of looking at the cost of anti-VEGF injections.
And in looking at the potential healthcare disparities among these groups, what did you find? Did you look at whether these conditions were more common in females or males? Did you look at whether they were more common in white individuals than Black individuals? What did you actually find overall, and was it different for each of these retinal conditions?
In terms of disparities, we approached this question in three different ways. The first one is there disparity in the prevalence of these four conditions when we look at patient demographics? And the answer is yes. The second question we asked was, in terms of disparity, was there a difference in the prevalence of these conditions when we look at geography down to the state and county level? And the answer is yes. And the third question was, did the prevalence of these conditions match the availability of retina specialists? And the third question was particularly interesting to me because it can provide us with some information in terms of the relative access or lack of access of patients to these retina specialists.
So tell me what differences you might have seen just in looking at females versus males. Let's just start there.
When it comes to males versus females, we found that across all four conditions, males had higher prevalence than females in age standardized estimates.
And is that consistent with what was known before? Is that different from what was known before? How did these data compare to what individual studies had shown? I know yours was a meta-analysis of many studies, but what did it show from individual studies? Were they in the same direction, different direction? What'd you see?
I'll break down my answers into two different parts. The first part is what's expected and what's not surprising. And the second part is some new insights. So what was not surprising was that we found a higher prevalence of AMD in white patients. This is a well-known fact. What was not surprising was the fact that we found a higher prevalence of diabetic retinopathy and diabetic macular edema in Black and Hispanic individuals. What is new about our study is that if you look at the literature, that has been a relatively small amount of data on national prevalence for retinal vein occlusion. And in our study, we found that the prevalence is roughly 2 times higher in white patients versus Hispanic patients. Also, because of the way that we did the study, we were able to provide some directional data on the magnitude of the difference. For example, the prevalence of AMD is about 1.7 times higher in white patients versus Black patients, versus when we look at diabetic macular edema, the prevalence of diabetic macular edema is roughly 4.6 times higher in Black patients as compared to white patients. So we get a relative sense of the difference in magnitude in the disparity.
And what's the actual magnitude of these conditions that you found? I mean, how common are these retinal conditions, macular degeneration, diabetic retinopathy, retinal vein occlusion, that you found from the meta-analysis?
Sure, that's a great question. I think putting some actual numbers will provide the audience with some concrete perspective. So I will start with the most prevalent condition and go down the list. The most prevalent condition is age-related macular degeneration, which affects roughly 21.9 million patients in patients over the age of 40. Next is diabetic retinopathy. We have about 10 million patients in the US with this condition. Of the 10 million patients, 1.8 million have vision-threatening diabetic retinopathy. Third in the line is diabetic macular edema. About 1.1 million patients have this condition. The least common one is retinal vein occlusion. Roughly 900,000 patients have this condition in this country.
You may say that's the least common at 900,000. That's still a lot of people who might need anti-VEGF treatment and isn't very different from the 1.1 million that you mentioned with diabetic macular edema. So to me, these are very important to recognize when trying to figure out resource allocation, resource utilization, maybe how to plan in the future. So what are the next steps? Where do you go from here with this information? Are there still questions that need to be answered in terms of recognizing the prevalence and the healthcare disparities that go with that?
I think uncovering some of these disparities is not surprising per se. If I have to pick one data element that's most interesting to me is our data on geography, because we were really able to pinpoint the difference in prevalence of these four conditions across the US, across different states, and even within each state, the difference in prevalence on the county level. And with that data, we were able to assess the access of patients to retina specialists based on publicly available data. So by mapping these two kinds of data together, we now have a national map of the mismatch in need for retinal care across the country. So hopefully with this new kind of information, policymakers and different stakeholders in providing retinal care will be able to plan resources based on geography and what these patients need.
And finally, how does this compare to the rest of the world? We have a lot of listeners from around the world. We have many people who read the journal from around the world or download various articles from it. Is this similar or different in different parts of the world? Can we generalize this to Europe? Can we generalize this to Asia, South America? What do you think?
I think the nitty-gritty details may not be applicable across the world, because if you look at the medical system and the racial or ethnic makeup of the population around the world, there really are a lot of differences. However, the central question, or what we're trying to find out, is indeed applicable, because ultimately, our central question is, can we come up with some reasonable estimates of the prevalence of vision-threatening retinal diseases that are VEGF-driven? And if we can quantify the prevalence of these conditions, can we also figure out where there's the greatest need for care for these conditions? And I think these approaches and these questions are indeed applicable around the world.
So this might serve as a model for other populations to look at in their cohorts, let's say in different parts of Asia or South America or Europe. Is that right?
I agree. Yes. Those would be very interesting studies as well.
And Australia and Africa as well. Well, I just want to thank you so much for speaking with us. I'm Neil Bressler, and I've been speaking with Dr. Alvin Liu at the Johns Hopkins University School of Medicine on a meta-analysis of the prevalence and healthcare disparities of retinal conditions. You can find a link to the article in this episode's description. This episode was produced by Daniel Musisi at the JAMA Network. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com or search for JAMA Network wherever you get your podcasts. Thank you, everyone, for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.